Hi everyone, I'm Stephanie with 9 Health. It's the final week of Mental Health Awareness Month, and all month we've worked with the Colorado Department of Human Services, their Office of Behavioral Health, to connect you with several experts, talk about several mental health topics, and hopefully get the questions that you have answered. If you have questions today, please put those in the comments. Today we're talking about the Behavioral Health Task Force, which was put in place just over a year ago, but kind of how things have changed now with COVID-19, what it is, how you can get involved as the public. So we're going to address all that with all these experts here today. First, I need to tell you some of our support for our mental health programs is provided by Regis University. They ask how you ought to live. You can learn more about Regis University's counseling and family therapy program on their website, regis.edu. I'm joined now via Zoom by Robert Worthwin. He's Director for the Office of Behavioral Health in the Department of Human Services. Summer Gathercole, she's Senior Advisor for Behavioral Health Transformation, also in Department of Human Services. Byron Pelton, he's the Logan County Commissioner, and 9 Health expert Dr. Paul Coley is joining us as well. She's a cardiologist, also an expert on preventive medicine, internal medicine. She can answer any of your coronavirus COVID-19 questions. So before we get into what the Behavioral Health Task Force is, Dr. Coley, can you give us an update on COVID-19 today?
So this week, Stephanie, has really seen a little bit of a transition in Colorado, really going back to work. The CDC releasing new guidelines yesterday on how employers can safely transition people back to work. Restaurants opening for the first time yesterday. We also had Arapahoe Basin open for spring skiing. So we're starting to see a little bit more normalcy, so to speak, come back into our lives. But again, as we go back to work, go back to our lives, we really have to continue to practice caution. And that is going to require a lot of behavioral changes on our part. And for some people, some of these behavioral changes can be distressing and can cause, difficulty. A lot of people are having quarantine fatigue, as they call it. So it's really important to start to think about how we can get into this new maintenance mode, which means socially distancing, but continuing to return to our lives and some of our social activities, but now doing it for several months and not just a few weeks.
Yeah, we talked about this the other day. I think that is the hard part, is knowing what the right thing is to do right now. And like we said, it's doing those things that you have to do. Maybe you have to go back to work, you have to go to the grocery store, but maybe not partying at the reservoir and that kind of thing. So still socially distanced, still practicing some of our safe practices so we can keep a good level and maintain things. Let's get into it now about the Behavioral Health Task Force. Robert, I'll start with you, Director of the Office of Behavioral Health for Department of Human Services. Just tell us what the Behavioral Task Force is and what the vision is about with it.
Sure. The Behavioral Health Task Force was established by Governor Polis in April 2019. We've heard from a number of our constituents and throughout the state, Coloradans, who just expressed that there is a need to improve the system and that we need to enhance the system so that we're meeting the needs of Coloradans. And some of the national data has shown that we're just falling short. So what we're hearing from individuals and Coloradans throughout the state matches what some of the data was showing, is that we're falling short on suicide prevention, intervention, and we're falling short on access to care. So the task force is charged with evaluating and creating a blueprint for improving the state's behavioral health system. This blueprint will be in some areas of reform, and in other areas it will be a modification to the current system. And then the areas that are working well, let's say, this is working well, let's stick with this portion of the behavioral health care in Colorado. The task force is made up of 3 committees, so the decision was to start with these 3 different areas. The first being the safety net subcommittee. What the safety net system is, it's for those individuals that are typically getting their behavioral health care either through one of 2 areas. They're either getting it through Medicaid, so they're being paid by Medicaid, or they're getting it through government-funded behavioral health. This includes folks who are involved in the criminal justice system, folks who don't have any insurance, who are uninsured. So those individuals that are needing help in getting behavioral health care. So that's the safety net system in Colorado. And we're really looking at making sure that we are providing the right level of care and enough care to individuals that need it. And then we have the right network of services in place. The second subcommittee is the Children's Behavioral Health Subcommittee. So children's behavioral health, too often we just apply an adult model to children's behavioral health, and it just doesn't work. And there are unique needs for children in Colorado as it relates to behavioral health, specifically when you think about foster care, child welfare, children involved in the juvenile system that are needs and they have a lot of trauma history. So we need to be really specific to meeting the needs of children as well. And then the third is the long-term competency. This is a group of individuals which the state is currently under a federal lawsuit and a consent decree with the federal court to meet the needs of individuals, individuals who go to court. Their lawyer says, Your Honor, my client has mental health needs. I think it's his or her mental health needs is interfering with their ability to understand the court process. Therefore, they can't really go forward with court. So if the judge says, okay, sure, we'll have the department evaluate that person to determine whether their mental health needs are getting in the way of their due process in court. And if they are, then they order the department to go ahead and what we call restore the individual, getting back to a place where they can understand the court process and go on with their trial. The state has struggled with this. The increase is over 1,200% since the year 2000 in referrals for individuals who meet this, and we just didn't have enough beds. So we've been working since June 2019 with Disability Law Colorado to come up with a plan to get the state in a better place where we can meet the needs of people who need competency services. So this long-term competency committee is making recommendations on how we can improve that system for individuals. The nice thing about that committee, it is co-chaired by Disability Law Colorado, who's the plaintiff in the case. So we are working together to come up with a solution for Coloradans. Recently, there's been a new group that's been added to the task force. This is a special assignment committee. Governor Polis asked the Behavioral Health Task Force to create this committee to address behavioral health needs specific to COVID-19. This group will be looking at two main things. One, what is the immediate needs of behavioral health and what modifications we need to make to behavioral health services, such as telehealth, to make sure that people are getting behavioral health needs met. And then what is our long-term plan as we think about behavioral health in a longer fashion when it comes to the pandemic?
Right, and with the pandemic, it's more of a marathon than a sprint right now. So it is good to think about those long-term plans, especially when it comes to behavioral health, mental health. Byron, I don't know if you can add to that, and then also just talk about what makes up our current behavioral health care system and some challenges with that.
Well, I can tell you out here in Eastern Colorado, a lot of the things that we deal with, like, I am chairman of the Eastern District, which is 10 counties out here. I represent the Eastern District on the Child Welfare Allocation Committee, and I'm also the chairman of the Board of Health out here in Northeastern Colorado. And what we see is a lack of services out here in rural Colorado, and the people seeking treatment are not able to find immediate and adequate help. And rural Colorado really suffers because of this. And I'll give you an example. We have Northeastern Colorado has a really bad methamphetamine problem up here. Last year, we removed 61 children from their homes just in Logan County, all due to methamphetamine. And so we really, our nearest detox center is 100 miles away. So it's very difficult to find adequate resources and adequate services in rural Colorado.
So then, and I'm just adding questions now, but so then as part of the task force mission, would it be to add services to, say, you're the Logan County Commissioner, would it be to add a detox center closer to where you're at? Is that something that is part of the task force job?
That would be something that I would bring up at the task force. I'm usually there fighting for rural Colorado all the time. And that sort of thing. But yeah, that's something that I would bring up, is something where we could have more of a system for all Coloradoans.
And Summer, maybe you could add to this as well, just what makes up our current behavioral health care system, and then even improvements being considered by the Behavioral Health Task Force.
Sure. So I would share that being that it's Mental Health Awareness Month, I'm sure you all have heard some of the stats already. Colorado has one of the highest suicide rates in the country. It's the highest reason for death among youth in our state. And we actually lose, before COVID, we knew that we were losing 3 Coloradans a day to suicide. There's an estimate that there's about 1 million Coloradans across our state who are in need of behavioral health supports. Last year, maybe 95,000 Coloradans who needed treatment for substance use disorder were not able to access that treatment, or chose not to because of stigma. So we have this huge need across our state. And one of the things that we've been doing within the task force is really trying to get out across the state and hear from those different communities about what their experiences have been. And I think the first thing that we hear is just Coloradans are just exasperated. The system is convoluted. They don't know where to go. We've heard from family members who said, I looked for years to find help for my children in my community. I didn't even know that some of these resources existed that I just found out about. And then once they get their foot in the door, a lot of times the first question they're asked is, well, what's your form of payment? You know, do you have private insurance? Are you on Medicaid? Do you have insurance? So we're not even asking the people who are in need of services, what is your need and how can we help you? The first thing we're asking is, what's your payment? And that's not the type of system that we want to have in Colorado. We want to make sure that people are getting the services that they need in a welcoming way. And we also want to realize that it looks different in every place across the state, right? So as Commissioner Pelton said, you know, what is going to work on the Eastern Plains, especially in Logan County, may not work over in Grand County or Jackson County. And so we want to be mindful of that and make sure that we have a system that is adaptable to the unique communities across our state.
Yeah, and I think that you talked about, you know, the first question being asked, what's your payment? I'm hoping with the COVID-19, that's pandemic, that's a positive that comes out of all of it, is realizing how many of us do need mental health support and how immediate we need it. And hopefully that's not the first question. I do want to talk about how COVID-19 has affected the task force work, but first I want to bring Dr. Coley into it just to talk about mental health in general and how COVID-19, we talked about this several times, but how COVID-19 is really affecting everyone's mental health, not just even those in those at-risk groups.
Yeah, so the CDC has actually issued some formal warnings for specific groups that are very high risk. But as you pointed out, Stephanie, we're all at risk for mental health problems. The groups that are particularly high risk, however, and should be, you know, carefully monitored are kids and adolescents, because for them, disrupting the social behaviors is really impacting not just their cognitive development, but also their behavioral development as well. They may not understand what's happening and why it's happening. Adults, or those vulnerable populations that are at risk for getting sick from the infection, are also particularly high risk for mental health problems, partly because there was already a loneliness epidemic amongst this population, and social distancing, stay-at-home orders and such have really exacerbated that problem. And secondly, because the physical effects are so worrisome with the condition, that a lot of older adults are actually starting to have mental health problems with excess anxiety and worry about contracting the infection and getting sick from it. Healthcare workers are and frontline workers actually are another high-risk group, because a lot of them can't really do some of the things that the rest of us are doing to keep ourselves safe. And finally, they say that anyone who's had problems with mental health before or substance abuse before are particularly high risk, again, because a lot of the resources and networks of these individuals fall apart as well. There's a lot of new data coming out about whether or not COVID-19 can directly affect your mental health as well. So these are the indirect impacts that we talked about, because we're changing our behaviors, our community is changing, how we interact is changing. But there's also some question of whether or not it can cause inflammation in the brain that can cause neuropsychiatric side effects. And so far, the research has mainly been that it causes delirium in the acute setting. So when you're sick with it, you can get delirious because of the fever, be confused, have trouble with memory, have trouble with executive function. But as best as we can tell, they don't appear to be any long-term effects. Having said that, based on data from the SARS and MERS epidemic, we saw that a number of people actually had depression, PTSD, and anxiety occur after those types of epidemics. So it remains to be seen what's going to happen after this one. But it's really important to keep in mind that behavioral health continues to be something that's at risk. And that's another one of those curves that we really need to work on flattening.
Yeah, we keep talking about, you know, that's the next curve to work on flattening, is this mental health curve, and taking care of our mental health and realizing when we do need help. Just talking about COVID-19, Robert, can you just touch on how COVID-19 has affected the task force work, and what are some of the short-term and long-term impacts?
Sure. So one of the things that we're looking at the immediate is how we can free up some regulations from providers, particularly national regulations as well as state regulations on how people interact with providers. There are a lot of requirements for face-to-face, as you can imagine. So the committee is looking at how telehealth can work for some populations. It doesn't work for all people, though. It's not a one-size-fits-all, but it does work for some individuals. One of the other things that the Office of Behavioral Health is looking at that we brought up in the committee are two key components. The first being we've received $2 million from the federal government for emergency funds for behavioral health related to COVID. And we're going to dedicate some of those funds to having an organization help other organizations access behavioral health funds and services. What I mean by that is there are a lot of shelters being developed across Colorado to help address COVID-19 and individuals who are struggling with COVID-19. And they need some assistance getting set up on getting connected to existing behavioral health services. The second is the research has shown that individuals who are on ventilators for an extended period of time struggle with depression and also opioid addiction as a follow-up of their ventilation. So we're looking to put aside some of our federal funds to follow up with individuals, to put a system in place where we can follow up and see how folks are doing post-hospital stay with ventilations. A lot of individuals who are put on those ventilators are put on opioids for pain related. And so they increase their risk for addiction, as well as just the mental taxing it takes of being in a hospital, being on a ventilator, and being and your life being called into question. Really, it's life-changing for folks. So we're checking in with those individuals because the data is showing that post-ventilation, there's some risk for mental health and substance use. The task force is looking at both those areas.
Yeah, we talked to a COVID-19 survivor a little while ago, and he just mentioned being very anxious and kind of depressed about the whole ventilator thing before he went on the ventilator, and then afterwards, he's still anxious about the whole infection and his recovery from it. So I do think the ventilator has some effect on that. Dr. Cole, I don't know if you can add to that the mental health effects of coming off a ventilator, whether maybe from not from COVID-19, but other reasons people might need a ventilator.
Yeah, actually, we've seen that even the substances that you use to put somebody on a ventilator, it's like opioids and benzodiazepines, even withdrawal from those can cause some of the after effects of coming off the ventilator. And as Robert said, certainly there is the emotional, psychological impact, because a lot of times, especially in COVID, when someone is put on a ventilator, the healthcare providers counsel them to say goodbye just in case they don't come off, because what we're seeing is that 75% of people, by some estimates, don't come off the ventilator. And so the process of, going through that experience can also cause effects. So there's biological reasons as well as psychiatric, psychological reasons why people coming off the ventilator can have after effects. There's also a phenomena called coronaphobia, where people who've had coronavirus, they're being treated like untouchables in the society. People are avoiding them. People don't want to be near them, when in fact, those are the people that are probably safer to be close to, because they're probably in the short term not going to get the virus again. But a lot of people are afraid that they may actively be shedding viral particles. And because there's been a little bit of an unknown as to how long that viral shedding goes on, a lot of friends and family members avoid people who have recovered from the coronavirus. So that can again contribute to the sense of isolation, separation, and feelings of loneliness. So there's many reasons after recovery why behavioral health could certainly be an issue. And then also for the family members of someone who's gotten sick, the experience of seeing that person go through something like that and recover can be traumatizing. We also at this point don't realize the long-term physical effects of coronavirus. There's some preliminary data that it may affect the lungs and cause some scarring in the lungs in the particularly severe cases. And in those types of individuals, their functional quality of life may be significantly affected. So if somebody was a runner before and then they ended up on a ventilator, they could, not be able to go back to the life that they knew. And that can certainly also impose some psychiatric effects.
Yeah, that survivor we talked about, just being difficult still to go up and down the stairs in his home, but he was, doing physical therapy, trying to recover. That story is on our blog, ninehealthfair.org. I keep referencing it if anyone wants to go check it out. But Commissioner Pelton, maybe you can just talk about, how you've seen COVID-19 affect, Logan County and the task force work, and just the impacts on the behavioral health system that you know of.
Well, I can tell you that in our county, I had a discussion with our human service director just yesterday about what he has seen in our county since COVID-19 and the shutdown and everything that's been going on with it. And he was very afraid of what we're not seeing with, because with the schools emptying out and the teachers not being able to see some of the happenings with child abuse. He was concerned about what is going on with some of the things that are happening in our county behind with stressful parents under stress and things that are going on, because we, like I told you before about what we had with our child welfare system in Logan County with 61 kids. He was concerned about that. We have seen increases in domestic violence in our county for sure. And then we usually find out then what happens with some of the neglect and that sort of thing with the children in our county. So it's been rough on all of us out here in Eastern Colorado. And like Robert said before, 30% of in rural Colorado, we have increased suicide rates. You're more likely to commit suicide here in rural Colorado than you are in urban Colorado. It's high. It's a lot higher. And we really, the Behavioral Health Task Force really needs to put together a system that works for everybody in Colorado. Somebody in Logan and Phillips and Sedgwick County shouldn't be treated any differently than somebody in Denver or Boulder or Pueblo County. So, I mean, that's kind of what we're seeing here in Logan County and with the COVID-19.
And just to follow up, do you just think that's just related to access to care? I know there's the Colorado Crisis Services line. I posted that in the comments. It's a phone line people can call. But do you think that's just because of the access to like a physical place for people to go?
Yeah, I think that there's definitely, we have some services here in Logan County. It's just the adequate and immediate services is usually what we need. I mean, when you have something like a treatment center or something where people can go to that's closer to their families and that support system, you're going to be more successful in treatment, and that would be and that's a good thing. But we just don't have that. So
and we talked about rural mental health last week, and just the mentality too of some of those in a rural community is they don't need help, they don't need to reach out for help, and then it's probably too late for them when they realize they do need something and trying to get access to it.
And the thing about it is out in rural Colorado, our communities come together and help each other, and we do the best we can. But sometimes that's just not enough, and you've got to reach out and get some professional help, and that's just sometimes what happens. And it's not any of our fault. It's just that sometimes you just need to reach out and get somebody that's professionally trained to help you. And that you're right. The reducing the stigma is the huge part about this.
Yeah, stigma, and we talked about isolation in a rural community, especially now during COVID-19. There might be feelings of being even more isolated. Summer, I don't know if you can add to how COVID-19 has impacted everything, and then also just maybe touch on how the public can get involved with the task force work.
Sure. Well, I'm going to just follow up real quickly on what Commissioner Pelton said, just around what we're hearing from different communities across the state in regards to there being some limited options. So if you can get over the hurdle of saying, I don't need services, and you're open to finally seeking behavioral health therapy or treatment or whatever it is that you might need. Some communities only have one provider from which they can choose from, and if that provider isn't a good fit, then they're really stuck. And so I would say I share that just because that's one of the big themes that we've heard from some of our public testimonies across the state, is that not only do Coloradans want easier access and an easier system to navigate, or someone to help them navigate that system, they actually want more choice at the same time. And that is, it's a balance between being a workforce issue and making sure that we have enough professionals in the field, and then ensuring that we're freeing up those professionals' time to allow them to be in the clinic, right? So that they're not doing paperwork for different insurance companies and so forth. So those are some of the things that we've been thinking about in terms of the task force. And I think we're all in agreement that we're going to need to do more around that as we see the impact of COVID-19 continue to hit our communities across the state in terms of the behavioral health conditions. For the task force, we definitely encourage anyone and everyone from the public to get involved. So all of our meetings are open to the public. There's actually opportunities, usually at the beginning of the meetings, to provide public comment. So if anyone wants to share an experience, share a recommendation for the task force to consider, we always welcome that. We also accept written recommendations if people are not comfortable kind of speaking out publicly. We do still have public testimony scheduled in June and July. Our next one is, let me see here, June 8th from 3 to 5 p.m. And so again, people, it's not in person right now, it's virtual. So people from all over the state can call in, they can video conference in, and take a couple minutes to share their experience and share recommendations if they have them. We also have our See Me campaign, which is seemecolorado.com. And that's really focused on helping to take some steps to break down the stigma across the state. So there's lots of different ways for people to get involved. If people are interested in learning more information about the task force, they can go to our website, to shorten it, we have a bit.ly site, which is www.bit.ly/COBHTF.
Yeah, and I put the link to the Behavioral Health Task Force in the comments as well too, if anyone wants to click on that. I'll add the cnecolorado.com as a resource as well. I want to let all of you go, but again, if anyone has additional questions about the Behavioral Health Task Force or mental health in general or anything, you can post those in the comments after the fact and I can pass those along to our experts. I do want to mention too that we have mental health screenings at 9healthfair.org on our website. Click on e-tools and there's free anonymous online screenings you can take for depression and anxiety. They just take a couple minutes. It's kind of a good baseline to see where you're at maybe just for the day. And if you need help, there's that option to reach out to some free virtual telehealth help right now. And also before we go, support for our mental health programs is provided by Regis University. You can learn more about their family counseling and family therapy programs at regis.edu. Become one of these experts that is, talking about mental health. And if you have a health question, whether it's coronavirus, mental health, a medical question, you can call our 9Health Neighbors line. I'll put that in the comments as well. Reach a 9Health medical volunteer. They'll call you back within 24 hours. If you call 303-698-4455 extension 2005, just leave a message, someone will call you back and you can chat with a real person about any of the questions you have. Also good if you have any neighbors that you know of that can't tune into these Facebook Lives and get their questions answered. I want to thank all of you for joining me and talking about this, and we look forward to seeing more from the Behavioral Health Task Force as we go forward and addressing some of the mental health issues in our state. Thank you so much.
Thank you.
Thank you.